part of it.
Yeah, and that's something else I wanted to ask. How do you deal with the patients who have really bad days? Because I'm assuming that not every day is a good day, and they have days when they
Well,
might not want to see a nurse or
yeah,
deal with their
yeah,
problem.
yeah, yeah. Um, Researching the cancer treatment and the cancer procedure, it have phase that the patient is go to. It have phase that in the beginning they just be like, oh, what the doctor say is not true. So they have a phase that they refuse to believe what is going on. And then it have a phase that they get vexed. Why me? Why it happened to me? I am so good to everybody. Why it happened to me? Then it have phase that they resignate and okay, whatever happened. And then it have phase where they get vexed and they wanted to fight. And then that's the time that they get depressed too. That's the time that, do whatever you want. It ain't helping anyway. And those is the patient that we really have to bring out of the deep and talk to them.
In all of your years working here, how many happy stories or how many positive stories that turn out well have you experienced?
Fortunately, a lot of them is happy stories. Fortunately. It have some people that come for treatment when it is late, and the only thing you could do is give them treatment to alleviate the symptoms and give them treatment to better the quality of life. But most of them is going over it. Research have shown that if you get treatment on time and you survive the first 5 years, then your chance of living is better.
So you can say that we have a lot of cancer survivors in St. Martin?
We have a few, yes. We have some that I know and we have some that I don't know that get treatment somewhere else. But we do have. We have people that sometimes even get it twice and survive it. So we do have.
So you're telling me that the cancer can come back?
Cancer is a sickness that the scientific them say it's never cured. It is a sickness that will go dormant, but it can come back. It can. If you're on time and you get your treatments and you get your exam and those things, then you can control it. But some people, it does come back with a vengeance and then you lose that patient.
Thank you once again. Stay tuned. We will be right back.
Are you looking for that prescription that the doctor just gave to you and you can't find it at no other pharmacy? Well, the Orange Grove Pharmacy is where you should be. Orange Grove Pharmacy, we carry a wide range of American and European prescriptions and drugstore items. We also do personal care products. We offer friendly services and 24 hours emergency delivery. Charges may apply. We're open Monday to Friday, 8 a.m. to 6:30 p.m., Saturdays, 9 to 1 p.m. Orange Grove Pharmacy, supporting a healthy lifestyle.
Welcome back to our special edition on breast cancer. Ladies, we were discussing, how you deal with these patients, their ups and downs, etc. But also what I would like to know is, are there other foundations out there besides the Positive Foundation that actually bring awareness and help these breast cancer patients?
Okay, St. Martin is not that far yet that we say we have a Princess Wilhelmina funds like Aruba and Curacao that helping the patients. But it do have people outside there that encouraging the patients, that come to support the patients. It have some that I don't know, and it have some that I only see them going by the patients when the patient is in the hospital. But it have a St. Martin Cancer Foundation that was dormant for a couple of years, and I think they want to start back with some activities.
Besides, bringing forth the awareness, does the Positive Foundation, if do they also contribute financially to these patients? Because I do assume that the cost of chemotherapy must be high.
I cannot speak for the Positive Foundation because I'm not part of them.
Okay.
The patients that come for treatment by us, 99% of them is insured. And it is a good thing that they're insured because these medications them are very, very expensive. And if they really have to pay for it, you have to mortgage your house and your car and everything and still not have enough to pay for it.
Okay, so what would you say would be like an average cost of a chemo session?
Oh, on a good day for us, it will be about $10,000 to $20,000 that you spend in 6-7 hours.
Really?
Yes.
It's that expensive?
Yes.
So
It have
indeed-
certain medications that is cheaper, but it have some medication, especially the new medications them on the market that are still very expensive.
Wow, so indeed having insurance it's something good to have. Nurse Saintia, since we're talking about the organizations that actually work with these patients, what about the actual breast cancer survivors? How do they work with these patients, and are they called regularly in to the hospital to talk to and give a positive outlook to these patients?
They are not called in regularly, but some of them will come out of themselves
Okay.
to help, especially if they know a person, they will come to talk to the person. And we have some people that is willing to talk about it and some that find that it's private and they don't want to talk about that. So we just feel the way where we can get someone to help and they will help. And we have some people that did come out for the open house and was open about it and speak about it and was very grateful to get the opportunity to speak about it.
Nurse Jackie, since you've started working with these patients, can you say that you have, learned a lot more and become more aware of the different cancers that are out there? Because, of course, it's not only breast cancer.
Okay, from the time I'm working there, I saw different patients with different types of cancer, and I'm still in the process because I'm not there that long. But
Yeah.
from what I'm seeing, it's a lot of different.
And Nurse Etna, because you've been working now along with them for 2 years. So you've definitely experienced a lot in 2 years, because 2 years is not a short time. What about your experiences?
Well, seeing the different type of cancers is really a shock. Because before, I would think that it was just breast cancer, but when you see colon cancer and different types of cancers, it really make you stop and think, look at your own life. Always want to share with others so that they themselves, can go and get checkup. Depends on their ages and so it's good that we could see different things that we're able to share with others.
Nurse Saintia, you've been working, like I've been saying this, because when you said 1997, that's quite a while back.
Yeah.
How do you bring about the awareness for, let's just keep it central now, for the breast cancer? Because we know that it's encouraged to do mammograms and so on. How do you encourage persons, young persons or persons 30 and up, to take care of themselves in order to maybe avoid it or to find out about it early?
Awareness, and more awareness. And believe me, it is not only 30 years. It have younger people now with breast cancer.
Wow.
It have people under the 30 years with breast cancer and discovered by accident, because you don't expect to have that on that age. So it is information and it is more and more awareness. And it is very important for a woman to know her body. If you know your body, you know what is normal, that when something comes, you know what is not normal and what don't belongs there. So I encourage most of the women them, get to know your body, get to know your breast, get to know how a normal breast feels, get to know how a younger breast feels, get to know how an older breast feels, and be aware of what can go wrong in that.
And right now I'm going to bring up a topic that I like talking about. Every chance I get to talk about breastfeeding, I bring it in because I know of the importance. And just coincidentally, I was reading, I think it's just yesterday, I was at one of the doctors and I read that they were actually saying that the more you breastfeed, it can also help to alleviate you becoming a breast cancer patient. So what do you have to say about that?
Breastfeeding can help alleviate you for a lot of sickness, not only with cancer, but a lot of sickness. And it is the best thing, I think, that was invented for a child.
And guess what? It wasn't invented, it was created.
I think so too. And but unfortunately, I have one of the folders them that when I was doing research for breast cancer, someone that have a baby, nursing a baby or pregnant can have breast cancer too. And that is a very bad situation because then you have to choose between the pregnancy and the treatment for the breast cancer. So it is a dilemma that I don't think none of the specialists want to be involved with.
Oh, so you're saying that someone can find out while they're pregnant that they have breast cancer?
Yes, yes.
Okay.
And that is difficult because on a given moment you have to choose between the baby and the treatment of the cancer.
Since you brought it up, is there a possibility then to continue with the pregnancy while you have the breast cancer and not treat it?
Most of the time we want to hold on to the hope that the child born first and then we deal with the breast cancer. But sometimes it's also how far the breast cancer is. But we, in 99%, we want to wait for the child to born first and then we deal with the rest.
Okay. Yeah, that is
Yes,
unfortunate,
yes.
that you have situations like that. So, Nurse Jackie, what would be your words to persons out there who are watching this program concerning breast cancer?
Okay, what I would like to encourage everyone is that get tested. Don't wait too late. The sooner that you do test, you get to know what you have to do at an early start. So don't wait too long.
And Nurse Saincha?
Well, I just have to say for the people them outside there to try to follow the rules them, get tested, get to know yourself, get informations and look out for each other, especially the women them, look out for each other, look out for your mother, for your children, and organizations them, we need you to come to support our patients them. So if it have organizations outside there that want to revive or do something about cancer patients, in particular breast cancer, welcome, get in contact with us and we will try to help the patients them.
And Nurse Edna, your final words.
What I would like to see is that for the Breast Cancer Foundation, I would like the community, the businesses to help invest in this foundation, that they can not be dormant anymore, but be effective in the community to help those that has need.
All right, ladies, thank you so much for all of the information that you have given us today. I believe that the work that you're doing will continue to be rewarded because you're assisting others and trying to bring about positivity and to help these people who, of course, like you said, sometimes go through some depressing times. So I want to thank you for all of the hard work that you're doing, and I want to continue to encourage you to bring about the awareness and bring about the love, because I believe these patients do need a lot of love
yes.
and care. And to you, the viewing audience, I want to thank you for having joined us today on A Better Place. I am your host, Angelique Martis Rumon.